Frida Kahlo's image, pulled from her numerous self-portraits, has been used as a banner for feminism, socialism, communism, indigenous rights, Mexican nationalism, gender nonconformity, bisexuality, disability, and trauma. An article in Teen Vogue even described Frida Kahlo as the original selfie queen. So much has been made public and even commodified from the intimate material of her life. Perhaps for this reason, Kahlo is often applied in psychobiography analysis, where many attempt to categorize her with limited, reductionist impulses. Identity is a useful framing to start with Frida Kahlo for a clinical social work study. Her political, social, cultural, and sexual identities remain salient throughout her lifetime. I argue for an anti-oppressive social work lens when analyzing the overarching life of Frida Kahlo. Born in 1907 in Coyoacán, Frida Kahlo was the third daughter in an arguably more affluent family than the indigenous populations and labor classes she so strongly advocated for. Historical trauma could be applied to Frida Kahlo as indigenous populations continue to experience enormous oppression, prejudice, and violence in the Americas. Her mother was of mixed indigenous and Spanish ancestry, and her father was a German photographer who immigrated to Mexico. Kahlo explored and celebrated her indigenous identity, often depicting her ancestry as opposites. In Las Dos Fridas, she painted a double image of herself, one Frida dressed in colonial European style, and the second in indigenous Mexican attire. Frida's celebration of pre-Columbian mythologies is the cornerstone of her work and contribution to the Mexican national identity. While some biographers claim Frida Kahlo denounced Catholicism for a free-spirited life, her paintings continue to show connections to the imagery of saints, crucifixion, or even the Virgin Mary. It is fair to say Frida was influenced by both her Catholic indoctrination and, more so, the indigenous belief system she wished to protect after centuries of oppression from colonialism. Frida Kahlo is celebrated for her expressive sexuality and open bisexuality, which was radical for a woman of the era. Biographies point to examples of her tomboyishness and gender nonconforming presentation starting in her teens. I would argue that Frida Kahlo experienced oppression due to her identity as a woman during her lived era. In classic patriarchal form, her husband Diego Rivera tolerated her fare so long as it was with women. Ultimately, Frida was a devoted wife who sacrificed for her husband above all else. It is documented in the film The Life and Times of Frida Kahlo that both Diego and Frida had numerous affairs following the cultural freedom of the Mexican Revolution. Diego's infidelity would have been somewhat of an expectation of married men at the time. Women, in the tradition of Marianismo, are expected to suffer. Frida expressed enormous heartbreak regarding her husband's infidelity, especially after his affair with Frida's sister. Their stress, no doubt, contributed to her already fragile and vulnerable physical state. It is undeniable that physical pain is a theme in Kahlo's life. Her biography has even been applied towards neurology and pain science journals. The manner in which these journals use Kahlo's paintings to understand her experience of pain is often more validating to the enormous resilience she demonstrated, in contrast to her portrayal through psychological lenses. Courtney, O'Haron, and Frank argue Kahlo's paintings could increase understandings of pain from the patient's perspective. Pain doctor Valmentes Burtis applies Kahlo's painting for an understanding of her disability. Frida's view of her own feet in the painting show a bleeding sore between the deformed big and second toes, a defect accompanying spina bifida. Frida Kahlo contracted polio in 1913 at the age of 6, and her right leg remained slightly deformed and shorter than her left. Frida's life would continue to be plagued with physical pain and ongoing surgery. Frida was at times frustrated, angry, and still affectionate towards the surgeons and doctors that were a continuous fixture in her life. Her painting, Self-Portrait with the Portrait of Dr. Farrell, applies a human heart for her painter's palette, her symbol for affection. This painting showed her gratitude to Dr. Farrell for having saved her life after performing 7 surgeries on Frida's spine in 1 year. In 1925, at the age of 18, Frida Kahlo survived a traumatic streetcar accident where a steel handrail penetrated Kahlo's lower torso, leaving her with a fractured pelvis and collarbone, 2 broken ribs, a broken leg, a crushed foot, and a spinal column broken in 3 places. She spent months in a full-body cast, and the trauma to her pelvis was one of the reasons she was unable to carry a child to term. In descriptions of this accident, biographers Marison and Beatrice and the filmmakers for Frida apply macabre, miraculous, beatific, and iconographic images of this event and the way Frida is so often contextualized. Kahlo went on to have more than 30 operations in her lifetime and continued to suffer from chronic pain until her death. Kahlo's right leg was amputated at the knee due to gangrene in August 1953. She became severely depressed and anxious and developed a dependency on painkillers, namely morphine. When Rivera began yet another affair, Frida Kahlo reportedly attempted suicide by overdose. Psychobiographers often highlight Frida's substance abuse in a manner that reveals the bias and shaming of addiction. Morris and Pietras write, Kahlo became a serious drug addict and got Rivera and others to buy her drugs. Once she asked another friend to give her an injection. She pointed to a drawer in a bureau, and he opened it, finding a box with thousands of vials of Demerol. In academic discourses, continued reductionist connections to Frida's substance abuse and psychological diagnosis are found. In one article, the author implies that if Frida Kahlo had been as resilient as other artists, she would have continued to go on to create more work. Critiques like this reduce Frida's death to mental illness and substance abuse, and leaves out the enormous larger picture of her life experiences, incredible chronic pain, and oppression due to her identity. There is debate in biographical representations of Frida Kahlo on whether it was an intentional suicide that caused her eventual death. The avoidance of suicide as a topic in some biographies speaks to the subject's taboo, as it still exists in a dominant Christian culture. Quote, the nurse said she counted the sleeping pills and found that 11 were gone. Had Frida deliberately taken an overdose? Had she taken them accidentally? There was considerable speculation. The controversial diagnosis of borderline personality disorder is often applied to describe Frida Kahlo's behaviors during these final days or in this time period following her leg amputation. In Cutchinson Kirk, feminist perspectives are given credence to this problematic diagnosis with historical understandings that show borderline personality disorder was named after white male therapists who asserted power over challenging or even sexually expressive female clients. Luce and Palermo mention borderline features when describing Frida Kahlo, calling it a defense mechanism to her multiple traumas with her applied skills to include splitting and omnisexuality. The use of omnisexuality as a feature for borderline personality disorder is especially troubling, as we know bisexuality may very well have been a foundational part of Kahlo's identity. Luce and Palermo go on to argue that Frida's, quote, borderline personality disorder typical behaviors and alcohol and drug abuses can be interpreted partially as the result of a post-traumatic stress disorder in comorbidity with a mood disorder. Diagnostic impressions sound hollow after an understanding of Frida Kahlo's lived experiences that led to her final moments. Psychobiographical perspectives can often be incredibly reductionist, as she was ultimately an enormously resilient woman who survived not only immense physical trauma, but the oppression of her gender and indigenous identity in a changing culture and time. Rather than being deficit-based and pointing to these last years of her life, it is more appropriate in a strengths-based analysis to identify what it was that she was doing well. Clearly, this is a person who lived an incredibly successful and vibrant life despite disability, chronic pain, multiple surgeries, and the oppressive political and social background of her lifetime. Frida Kahlo continued to advocate for indigenous rights and the sovereignty of Mexico and other Latin American nations. In her final years, despite her trauma and pain, Frida Kahlo joined an anti-American demonstration organized by the Communist Party in Mexico City to protest the removal of Guatemala's president and the involvement of the CIA in Latin America. Quote, about 10,000 people showed up, and Kahlo was the star of the show. Rivera pushed her in her wheelchair through the crowds, and people fell in line behind them. Gringos asesinos fuera. Yankee assassins get out. Frida's paintings feature visceral themes of femininity and women's lived experiences. In one painting, she depicts her own miscarriage. In another, The Suicide of Dorothy Cale, she provides a blunt depiction of a woman driven to despair by male desertion. Juliet Miller considers how a patriarchal world distorts women's discoveries of their own voice and interpretations of experiences. She argues, the dynamics are complex and conflicted for women for a variety of historical and cultural reasons, and that this has been exacerbated by psychoanalysis and psychotherapy. A famous quote by Frida Kahlo is, I suffered 2 grave accidents in my life, one in which a streetcar knocked me down, the other is Diego. Frida Kahlo lived the majority of her life behind her husband Diego Rivera's immense shadow. She is an idol for many women, not because she overthrew the patriarchy, but that she remained and thrived with a sense of her own identity and a marriage to such a powerful figure. I recognize my own privilege as a white woman in the era I live when I wish to challenge Frida Kahlo to ask more of her marriage and deserve fame that was not fully realized in her lifetime. Although the relationship was fraught, Frida and Diego remained partners with a deep affection and strong commitment to a noble cause. Frida insisted on a life well lived, even if it was not long. In her last painting, she leaves us with the message, "Long live life." Frida's still life of watermelons makes this line visible in the title included in her frame, "Viva la vida." Diego Rivera, in the end, echoes and honors his wife in a final painting before death, his very own still life of watermelons.